Welcome to the NedDose, your trusted source for better medication education. I am Aisha, the founder of NedDose, and we're going to dive into some blog post summaries. However, first I would like to note that I am a pharmacy technician and not a pharmacist. Please contact your healthcare provider or pharmacist before making any medication decisions. The first summary I'm going to go into is regarding medication expiration dates. It is important to know what to do when your medication expires. Many people are not aware of the expiration date on most of the medications in their home, possibly due to simply forgetting to check, comfort in having the medication around, or the patient could be non-adherent to the drug, therefore just not checking the drug at all. The main goal of stating an expiration date on the drug packaging is that the company has tested to see how long the drug will be stable once packaged. So as you can see, the expiration date guarantees potency of the drug, safety of the ingredients, quality of the medication, and like I stated above, stability until the date. And one thing to note about that date is it's not a hard stop date, it's an estimated date. So is it safe to take expired medication? The short answer is that it's not advisable. There are various risks to taking drugs beyond their expiration date, including reduced effectiveness, improper treatment, worsening illness, bacterial contamination and those that apply, and degraded ingredients. So again, my take on it is don't take the risk, dispose of expired medication once aware. The effectiveness of the medication may begin to decline, making it difficult to know whether it will provide the intended therapeutic effect. While this may seem harmless, it could potentially lead to dangerous consequences. And storage is also very important, as if it's not stored correctly, that could also bring the date closer. If you have expired medication you want to dispose of, many pharmacies will take them back, or the FDA also has an approved flush list where you can put them either flush them down the toilet or down the sink. The next one that I would like to go over is medication interactions. Interactions can occur not only between prescription medications, but also with over-the-counter medicines, vitamins, supplements, and certain foods and alcohol, showing that it is not always another prescription drug that could interfere with the original drug. One of the leading causes of the lack of awareness is that many OTC medications, vitamins, supplements are marketed as safe or natural. However, natural does not mean harmless. So what is an interaction? An interaction occurs when one substance causes a change in another substance. It may make the medication less effective, increase side effects, or even cause dangerous health complications. Types of drug interactions include drug to supplement, drug to food, and drug to alcohol. For more details on the types of interactions, be sure to stop by at theneddose.com. So everyone is at risk for a potential drug interaction. However, some populations are more vulnerable than others. Patients who take multiple different medications and those with chronic illnesses tend to be the most at risk. If an individual suddenly becomes dizzy, extremely drowsy, confused, experiences a rapid heartbeat, or has difficulty breathing, it could be a sign of a potential medication interaction, and it is important to get this patient help right away. And the last one I will summarize is regarding medication reconciliation. Although creating a medication list may not seem like a big deal, it is very important for your healthcare team, including the pharmacy team, to know exactly what you are taking. The main goal of NedRec is to create the most accurate medication list possible for the patient, providers, and pharmacists to ensure patient safety. This list should include everything taken by the patient, including vitamins, supplements, and over-the-counter medications, because as stated above in the interaction summary, all those drugs could interact with each other. NedRec can be completed at the time of hospital admission, transfers to other facilities or home, discharge from the hospital, and in the outpatient setting. Errors in this process could occur for anyone, and some causes include omission of medications, incorrect dose or frequency being stated, duplicate medications, incorrect allergies documented, or the patient does not discontinue a medication that should have been stopped previously. Although technology could aid the process of NedRec, it is important to listen to the patient and allow them to advocate for themselves. I would like to end by saying that if you enjoyed to learn more about pharmacy topics or enjoyed this video, Please be sure to like, subscribe, and visit themeddose.com.